The Democrats' over $1 trillion infrastructure bill has unfortunately passed both chambers of Congress, and at this point is only waiting for the president to sign it. Barring the end of the world, it's supposed to be signed into law on Monday. But what about the other $1 trillion progressive wish list, the Build Back Better bill, as it's called? We'll discuss these and more with Congressman Greg Murphy on this Veterans Day edition of Washington Watch. Congressman Murphy serves on the House Veterans Affairs Committee. He is a medical doctor who's practiced medicine before entering Congress. Congressman, welcome back to the program.
Hey, Tony, good afternoon.
Let me just ask you first, as a member of the House Veterans Affairs Committee, how have you seen our care of veterans? What's the status of that under this administration?
Well, Tony, I think it's fair. I give it a C plus, maybe, as we're putting forth our efforts. You know, I am honored to represent a district that has the sixth most veterans in the country, about 95,000. And being a physician of 30 years, obviously those two priorities are very big ones to me. It's sad that at the beginning of this administration, they put a priority of having transgender surgery over one of my priorities in healthcare, and that's the treatment of post-traumatic stress disorder and traumatic brain injury. You know, you look at the number of suicides that are going on in our veterans every day, 17 a day, and that number's climbing. And the number of overdose deaths in our veterans, which is actually 65% higher than in the general population. That's where we need to be putting our energies, not into gender reassignment surgery or transgender surgery. It's just, in my opinion, they started off with a very, very poor priority list. And unfortunately, I think that's continuing today.
Yeah, it is unfortunate. As I've spoken to some of your colleagues and others that are involved in veteran care and veterans themselves, those who in particular served in Afghanistan after the debacle of the retreat from Afghanistan, we've seen kind of a spike in veterans dealing with emotional issues. Is the Veterans Affairs Department, are they responding to this?
Well, very interesting, Tony, because I sent a letter to the chair of our Veterans Affairs Committee, a Democrat, and asking him to convene a meeting specifically to deal with that, and basically did not get a response. That's very, very unfortunate, because we had veterans in our community that just recently served in Afghanistan. They knew people who were being left behind. And then we had veterans from other armed services that had served in previous conflicts that their emotions ranged from embarrassment to shock to utter disgust about the way that the Biden administration withdrew from Afghanistan. And the fact that, Biden said we would not leave anybody behind, but in fact he did. And we know that for a fact. We know that there's still hundreds of Americans today still left behind enemy lines.
Yeah, people don't realize the impact that has emotionally on members of the military who served and lost colleagues. They lost fellow Marines and soldiers in those battles. And then to see the United States pull out the way that they did, it opens up a lot of those wounds, oftentimes that have been undealt with. And so it is critical. It's a part of it. The Veterans Affairs is a part of that. Obviously, the faith community has to step in as well. I will say this on behalf of the Veterans Affairs, that at least the director there has just given approval to all religious exemption requests for those that work within the department who have had concerns about the COVID vaccine mandate. So that's, at least there's one department within the federal government that is recognizing these religious exemption requests.
Yeah, at least for now. It's sad, Tony, that this administration and other administrations, and I think this is, you and I could talk about this for hours, but the very foundation, the Judeo-Christian foundation of this nation is being pushed aside. And that's why we have such moral relativism, not only in civilian life, but in governmental life. And it's good to see every pocket now and then of some sensibility coming from at least one aspect of government. I'm not overly optimistic that will continue. Because of the federal mandates now in some certain aspects in military forces, the SEAL team, for example, they've had problems with this mandate. And let me just make very clear, and I'll just take a quick aside. I'm a physician. I've studied the literature. I believe people should be vaccinated. But when we push the government over the individual and you get involved in the doctor-patient relationship, which I believe is a sacred relationship, and you make it between government and citizen, I believe that the government has vastly overreached its responsibility and its duty for that matter.
Well, since you brought that up, let me ask you this question, Dr. Murphy. With 10 states have now filed suit as of yesterday against the mandate for any medical institution or entity that receives Medicaid or Medicare funding. That covers about 17 million healthcare workers. In part, the suit says this is going to create dire circumstances, especially in rural America, by the fact that the reality is we already have a shortage. What's your view on that?
Well, Tony, I thought that was coming because prior to this, with the flu vaccine, our institution, our medical institution, which is a very large hospital, close to 1,000 beds, has always mandated the flu vaccine, and everybody's done that. However, this is an entirely different set of circumstances. And prior to the federal edict last week, they allowed for religious exemptions, and they actually also allowed for natural immunity. But now the fact that they are ignoring the science of natural immunity is exceedingly troublesome. We are in a dire shortage. We have close to 1,000 beds in our hospital, but at any point in time, there are 100 or 200 closed because we don't have enough nurses. And now we're going to squash out 20% of those who say they just don't want it. They're young, oftentimes female, and are concerned about, which I have to disagree with, but that still is their concern about the vaccine. It's just, it's sadly that sometimes the other side of the aisle does not think past their emotions and actually think about consequences. We're going to actually cause people, kicking them out of their jobs, to lose their jobs, lose their health care, throw them into poverty. And we know that one of the quote words of social determinants of health, things that determine somebody's health, welfare, and morbidity and mortality, is poverty itself. So we're actually, in my opinion, actually going to cause more distress for this nation in a population that oftentimes has minimal risk from this virus, and cause them much more damage than we actually produce good.
Do you think this is an unintentional consequence, that they really didn't think through this, or is this another effort to create a crisis in our healthcare to give the government more control over it?
Well, it's probably a little bit of both, Tony, to be very honest with you. I don't believe they actually think through their consequences of what they do. Look at the inflation. Look at some of the other issues we can talk about. I think they base things, and this is oftentimes a liberal progressive mantra, is they think things emotionally rather than they think about the secondary, tertiary, quaternary consequences. Is this government overreach? Yes, the Biden administration has shown that it cares more about a top-bottom approach rather than an individual rights approach than anything. They've shown that in so many different sectors here, and pushing it into the healthcare, again, as a physician who advocates for vaccination, is just another example of what they do.
Congressman, I know you're going to have to run in just a minute. We just got a couple minutes with you, but you made reference to the inflation issue. I want to play a quick clip of the president's chief of staff and what he had to say on MSNBC about the president's plan. Play clip number 3, please.
I understand that voters are frustrated. We inherited a mess from Donald Trump. We inherited 4,000 people a day dying from COVID. We inherited only 50,000 jobs being created a month, giant supply chain problems, all these problems. I'm proud of the progress we've made in these 10 months, but I totally respect the view of the voters that we haven't made enough progress yet, that we haven't gotten enough done yet.
We got a minute left. I'll give you a quick response to the president's chief of staff.
I'll just say 2 words. That's tone deaf. Tone deaf. They are totally tone deaf to the facts of what they have caused. I mean, good Lord. And the fact that they've caused so many of these self-inflicted crises, inflation, defund the police, the border crisis, they are tone deaf to not only facts, but more importantly, they're tone deaf to the needs and wants of the American people. And so, they're living in a fantasy land, and the American people now, truly, as was evidenced in Virginia, understand that and are fighting back.
Yeah, I have more confidence in the American people than I do the Biden administration, to tell the truth. Yeah. Congressman, always great to talk with you. Thanks so much for being with us, Greg.
Thank you so much, Tony. God bless. Have a good day.